News for the soul that you celebrate. Log on to www.newsforthesoul.com. Come here, the good news. Share the good news. And we all feeling good for the good news.
We are streaming.
You are listening to the News for the Soul Radio Network. News for your soul. Life-changing broadcasts to souls around the world since January 1997. Next on News for the Soul Radio, it's time for Perfectly Holistic with Pam. Pam is a cat mom and holistic health seeker who, after suffering an injury that wouldn't heal, was led on a journey to seek out alternative, holistic, and natural medicine. She now shares what she learned, helping people and their cats along their path to holistic health. Pam has taken courses in holistic health for animals, muscle testing, and animal communication. Please welcome Pam. Back to News for the Soul.
Happy Monday, everyone. This is Pam with Perfectly Holistic. I am so excited and honored to be here with you guys tonight. I have a very special guest, a new bestie. And I'm going to tell you a brief bio about her, and then we'll bring her on. So Dr. Katie Woodley is the proud owner and holistic veterinarian of The Natural Pet Doctor. And after watching her husband develop an autoimmune disease and be told there was nothing they could do other than strong immunosuppressive medications, Dr. Katie went down the path of holistic medicine. Becoming certified in acupuncture and Chinese herbal medicine changed everything for her pet patients. She started The Natural Pet Doctor after being in the conventional vet world for over 10 years to provide pet parents with more resources for natural medicine advice and care so that they had all the options. Her mission is to ensure that all pet parents have access to herbal medicine, supplementation, nutritional advice throughout the pet's lifetime that helps them thrive rather than just survive. Dr. Katie offers telehealth consultations to pet parents across the world and provides house consultations in Northern Colorado region, along with online education through her courses, membership, YouTube channel, Facebook, and Instagram. And you can find out more about Dr. Katie at thenaturalpetdoctor.com. So welcome, Dr. Katie. I'm so excited to chat with you tonight.
Thanks, Pam, for having me. And I'm really excited to be here. I feel very blessed. So thank you.
Well, we decided when we first talked that feline pancreatitis was like, you and I both thought of it at the same time. We were like, oh my God, you're reading my mind. Because you, I know, probably seen so many pets that deal with pancreatitis. And all the symptoms that kind of go into that people aren't even aware that their pet may have pancreatitis. And I see that a lot of times with cat clients as well. Some have been diagnosed with the chronic, ongoing feline pancreatitis issues. And then some of them are just, their pancreas resonates and they're throwing up the bile and they're doing all that stuff. And so I'm like, you know what? We really need to talk about this topic because it is such a huge, there's a huge demand for helping people implement the right changes to avoid it and just helping pet parents navigate through it because it can be so challenging.
Yeah. And, I find, so pancreatitis, it is really common in both dogs and cats. And I find with cats, especially because some of the symptoms can be vague. And I feel like sometimes it just forgets to be checked. And it's this where these cats go through this up and down where they're not feeling good. Then they bounce back and then they go back to not feeling great. Maybe they have some GI symptoms like vomiting or diarrhea, or they're just not eating well. And these poor cat parents are toughing it out. The cat's not feeling good and they don't know where to turn, and it ends up being pancreatitis. So I think it's very important that this is on our radar, that it's on your radar if you're listening and your cat's going through this up and down cycle, to make sure that we're asking if your vet's not offering certain diagnostic tests when you go in, if your cat's displaying those symptoms, so it doesn't get missed.
Right. And I think a lot of people just feel like their cat gets finicky.
Yes. Yep.
And they're throwing their hands up in the air going, well, you ate it yesterday. why don't you eat it now? And now you're throwing up, and now you won't touch it. And so they're spending a lot of money, wasting a lot of money on foods, but they're not changing the proteins. A lot of times they're stuck on the same old thing all the time, and just so it's like a rut.
Yes. Yeah. And I think we kind of start looking at, when we look at pancreatitis and why does pancreatitis happen? And for the most part, one of the most common reasons is like the food that we're feeding our cats. And when we start looking at some of these diets that our cats are eating over the counter, if it's a prescription food, and especially when we look at dry food diets, it's not a species appropriate diet. Our cats are obligate carnivores, and they benefit from higher protein, fresh, less processed foods. And what we find is the way that pet foods are made, especially kibble diets, a lot of those, and even canned foods, a lot of those fats can go rancid, and we can have issues there. And what that's doing is it's putting more stress on the pancreas. And so we think we're doing the best thing for our cats. And in reality, it's a diet change that needs to happen to help these cats start to recover.
Absolutely. So that's a good place to start. Why don't we talk about some of the triggers that cause pancreatitis in terms of diet?
Yeah, so our diets, the biggest thing that I always go to is, what is the protein concentration? How processed are the foods? So a lot of cats who are in these dry food kibble diets, they are at a much higher risk of developing pancreatitis. And what a lot of us don't realize is that those high carb diets, what's happening is those carbs are turning into sugar. It's leading to things like insulin resistance in the body. So the cat can't process insulin as well. They're not being able to process their blood sugars are going all over the place, and they're more prone also to things like diabetes. So a lot of these cats with chronic pancreatitis end up with the diabetes and having to go down the path of going on insulin because of these poor quality diets that they've been on. But those are a big stressor for the pancreas and setting up this low grade chronic inflammatory state of pancreatitis with these kitties.
Right. And sugar is very inflammatory.
Yes.
Same for people. If we eat sugar in that concentration all the time, we're going to have constant inflammation in our GI tract too. And over time, that inflammation creates, a much, much worse condition, like your diabetes, like your cancers, and your IBDs and lymphomas and things like that. So it is super, super important that we start analyzing the diet right away.
Yep. And I mean, alongside that too, when we look at the diets that our cats are on, so if it is a highly processed diet, so something like a kibble diet, or if it's even a canned food diet, maybe there's something in there like carrageenan or some other chemical that's setting up inflammation in that GI tract. And as Pam, as you just said, that inflammation, it doesn't just stay there in the gut. What happens then is it sets up that inflammatory pathway, which leads to those other diseases in the body. And so when I always talk to pet parents about this, is like reading pet food labels and going through what other chemicals can I interpret this pet food label? What's on here? Are they using real proteins, or is it something that's a highly processed rendered meat, right? Like something like meat meal. So if you see meals on those ingredient lists, this is a more processed protein that isn't using human grade ingredients, meaning that that meat was not good enough for us to eat as a human. And so it goes into the pet food industry. Our cats are now eating it. It's setting up this inflammatory cascade in their body. And I find that pancreatitis is kind of this root issue that does lead to all these other diseases. And so looking at your ingredient list, looking at how can we transition their diets, food is definitely number one if your cat is in this area of developing chronic pancreatitis.
Yeah, I totally agree. And I think that most people whose cats have this diagnosis of pancreatitis are a lot of times they are falling for the marketing hype on the pet food bags, thinking that what they're feeding them is good quality, even though it's dry food. Because I hear that all the time. Well, it's a high quality kibble. which I think is an oxymoron. I don't really think there's anything high quality about kibble. It's all processed and it's metabolized the same way in the gut. You know, the gut doesn't know if that's high quality or low quality. It's all sugar.
Yes. And it's putting pressure on the pancreas, which is
It's
why we
still
see
doing the
pancreatitis.
same job, you know, it's still hurting the pancreas. So it doesn't really matter what you want to deem it as high quality or not. So talk about some of the, you talked about the meat meal, which is great. What other ingredients should pet parents look for on the label? Because I think that one of the first things they need to start doing is turning the bag around and don't look at the pretty pictures on the front. Look at the label.
Yep.
And let's identify what's in there that could be a possible cause of, you know, GI stress that can lead to this.
Yeah. So remember, cats are obligate carnivores. They have
Mhm.
zero physiological requirement for carbohydrates. And what we find is in order to make kibble, so to extrude it at high heat temperatures, we have to pack it full of carbohydrates. So we have a lot of grains a lot of times. And if we're not using grains, there's a lot of things like pea proteins and we have corn, oats. These are all things you want to be looking for. And what these pet food companies know is that they know you want to see meat as the first ingredient. And with ingredient lists, the highest concentration ingredient in that food will always be listed first. But what most pet parents don't realize is that when you create kibble on that ingredient list, that meat that's listed, maybe say it's salmon and it's the first ingredient, that's still with all the moisture. And so we still have 70% moisture, 70 to 80%, 90% moisture. What happens when that kibble is cooked at those high heat temperatures, we lose all that moisture. So what then happens is salmon is now not the first ingredient. And now oats, corn, all the things that a cat should not be eating. Now, the other problem with those ingredients is that corn and oats and legumes are sprayed with glyphosate or Roundup. So we don't see that ingredient on the ingredient list. We will never see that ingredient on there. But we know that if it's not an organic, so if it's not listed as organic, that it is heavily sprayed with glyphosate. And the problem is too, I find a lot of pet parents, cat parents, they want to feed grain free and they're trying to do the best thing, right? Let's get rid of grains. And what happens is those companies pack that product full of pea proteins, so or legumes. So you'll see pea protein, you'll see chickpeas, you'll see, you know, these other types of ingredients. And these are actually more heavily sprayed, or they actually have higher concentrations of glyphosate than even say your corn or your oats. And the reason why is that those products, those non-GMO products, are sprayed at the end of harvest. And so what that means is it speeds up the plant being dried out and being able to used in the pet food. And so there's all these little things where you're not going to see always these types of ingredients or these chemicals on the food. But if you're seeing those ingredients being used and they're listed on the ingredient list, you want to avoid them. So if you have a kibble addicted cat, because first things first, if you can get your cat off of kibble, 100% do that. But if you have a cat where you're having a harder time, you want to look at that ingredient list. Try to get a pet food that uses human grade ingredients, is lightly cooked or baked if you can, that has a predominance of proteins, actual real meat proteins at the beginning of that ingredient list, and has less of these higher carbs full of glyphosate options towards the end. So those are a couple things to look for when you're looking at those ingredient lists on the back of the bag.
And then do you find things like ethoxyquin and BHA and BHT and
BHQ,
TBHQ and propylgalate and propylene glycol? I mean, all of those ingredients and food dyes, I mean, those can also irritate the GI tract and cause major issues just from like chemicals exposure, you know, and that's got to also have an effect on the whole pancreas and the GI tract.
Yeah. So when we're talking about pancreatitis, it's an inflammatory condition affecting the pancreas. That's what itis, inflammation, pancreas, inflamed pancreas. And when we start looking at all these chemicals and the artificial ingredients and food dyes and preservatives and products that have, Roundup and chemicals sprayed on them, what's happening is that when that food or those chemicals come into contact with the gut, we have this amazing microbiome we should be protecting. So trillions of different types of bacteria, protozoa, fungi, this ecosystem that is keeping your cat happy and healthy, or it should be. When all these chemicals come into contact with your cat's gut, it actually kills that microbiome. It's killing the good bacteria, and it's creating localized inflammation. So what happens is not only does the gut now is inflamed, but now we're getting toxins and bacteria and all the things that shouldn't be passing through that gut lining into the bloodstream. And the pancreas sits right there. It's also working harder. It's trying to release all these digestive enzymes to break down a species inappropriate diet, this high carb diet. And now it's being bombarded through the circulation also by these inflammatory chemicals. So the immune system's working overtime. It's seeing all these things in the body and the circulatory system and bloodstream that it shouldn't be there. So it's working overtime. The pancreas is working overtime. And all of a sudden your cat is way out of balance. It's not feeling good. The digestion isn't working. We're starting to see anorexia. They stop eating. And because of all that inflammation, we're seeing vomiting, we're seeing diarrhea. Your cat's belly is sore because now they're gassy, and that inflammation is sore. It's painful. It's a painful condition.
Yeah.
So that's how that all plays a part, and why it's so important, where it seems like this food doesn't really affect them, but in reality, it's causing this cascade of inflammation to happen that's creating all these other problems alongside the pancreatitis.
Mm-hmm. I think of it like the perfect storm.
Yeah, it is. I mean, the unperfect storm.
And until you have an intervention and stop the perfect storm, it's just going to keep perpetuating itself. And so, talk about the whole. And you mentioned it a while ago, the grain-free products. Because people think they're doing a better job by selecting a grain-free product, but a lot of times, again, it's that marketing hype that people fall for. So you can find grain-free wet food, which is great, but even the grain-free dry or whatever is not good.
Yeah. The problem with grain-free is that the companies have now replaced a more expensive meat protein with pea protein.
Mm-hmm.
And it's not as well absorbed in the body by cats. Cats don't eat peas.
Right.
And also you have now this extra element of, we know that these types of foods are sprayed heavily with chemicals.
Yeah.
And we know glyphosate directly kills the good bacteria in the gut.
Mm-hmm.
And it creates behavior issues. It creates all sorts of issues and is not doing anything good it's an antibiotic. It's the most widely spread used antibiotic in the world. And so when we're trying to do the right thing, a lot of cat parents go for the grain-free, but you're better off almost. I mean, grain-free is not going to be better. I hate saying that, especially if we are feeding a kibble diet. Looking for, if once again, trying to transition those cats over to a more species appropriate diet, like your canned food, your freeze dried, your dehydrated, or even if your cat can tolerate a raw diet, can be definitely more beneficial. And it's going to also, as we look at less processed diets, are going to have more live enzymes. Your cat's going to recognize those proteins better. There's typically less chemicals that are in those fresh food diets that are going to cause more inflammation in your cat's body. So I think that it always comes down to that. I just see so many diseases: diabetes, pancreatitis, cancer, IBD, kidney disease, that are not being helped or have been caused by a dry food diet.
Yeah. And just for the listeners who are not even sure what legumes are, it would be your lentils, your navy beans, fava beans, garbanzo, pea fiber, pea protein. Would you lump pea fiber into something like that? Would that be a no-no, or is pea fiber?
I
It's
would,
spray,
because
right?
it's coming from the
The
peas.
peas.
Yeah.
I've always
So,
been real hesitant about anything peas.
yep.
Yeah.
And I saw Christine just mentioned too, she didn't realize that grain-free doesn't mean carb-free. And that's a common misperception with pet parents. And, you think this is where we think we're doing the right thing because of the marketing. And these tend to be very high carb diets. Also, it tends to be high sugar. They are processed very quickly in the body. I almost find that they tend to have a higher sugar rush from those types of foods. And I find a lot of cats become diabetic when they've been feeding these types of diets for, years and years.
Yeah.
And it's that stress on the pancreas just essentially gives up, and it can't produce enough insulin to keep up with what's going on. This is also where, if you have a cat that's overweight, the amount of pressure that is on that pancreas is so high. And being obese and being overweight also increases the level of inflammation in the body. So not only is the food probably not appropriate and it's not helping them lose weight, keeps them hungry. So if you ever had a cat that's always really, really hungry, and you're just like, why? They eat all the time. Why are they so hungry? And it's because of that insulin resistance. And when we start changing their diet and reducing that inflammation and taking some of that pressure off the pancreas, that's where all of a sudden we start seeing them drop the weight. They become more lean. They're less hungry. They feel better. And they have less chronic health issues and diseases, and they become more balanced.
Right. And their body can actually utilize the nutrients.
Yes.
Because they're being broken down effectively by the pancreas and digestive enzymes that are being produced. So it can assimilate those nutrients better. And so, yes, they don't feel like they're starving all the time because they're actually able to utilize the nutrients better.
Yep. Definitely.
Yeah.
And I think too, like some of the other reasons why we can see pancreatitis in cats, we can see it from trauma, less common, right? But if there is trauma to that area in the front part of the abdomen, that's where the pancreas sits. So if you have an outdoor kitty that gets hit by something or does something silly, that can cause localized inflammation. We can also see if your cat's been on medications, or maybe they're on chronic medications, sometimes that can trigger pancreatitis too. So these kitties that are on chronic steroid use for like inflammatory bowel disease, the pancreas is working overtime. And commonly we're seeing a side effect of that steroid use is pancreatitis. Now, this is not me saying to stop the steroids. Make sure you talk to your veterinarian, because stopping steroids right away, like suddenly, can create a lot of adverse side effects and can make them really, really sick. So you want to work with your veterinarian or work with an integrative or holistic veterinarian to determine the path of how to start reducing the steroids and replacing it with herbs, homeopathy remedies, using food as medicine, and getting them much more balanced. And it can be done. It can definitely be done, because I know Pam and both myself, we're both getting these cats off of these medications and bringing their bodies back into balance. But, look at, what is my cat currently taking? Are they on medications? Or are they going on antibiotics all the time for, potential infection, or maybe they have skin disease, or, some other health issue that seems completely unrelated. But what's happening is that pancreas is inflamed. The drugs we're using are keeping your cat in that flare-up cycle and making the problem even worse.
I thought of something else that can also be an issue is parasites. I had a cat years ago who had developed this pancreatitis. I had never seen it before. And we went to the vet because he was throwing up the yellow bile or whatever. And so they put him on Convenia or something to stop the nausea. Reglan, does that sound?
Oh, it was probably Serenia.
Serenia? Okay.
Yeah.
So they put him on that, and he did okay for like a week, 10 days or whatever. And then it started again. And this was back when, I used to feed dry food. I'll admit it, because I didn't.
I've been there. It's okay. We've all been there, probably.
We learn from our mistakes. But after like 3 different times to the vet, the doctor threw up his hands and says, well, I can't help you. You're going to have to go to a specialist. And I'm like, specialist? What do you mean specialist? You know, he wanted to send me to this very expensive, you know, medical center for pets here in Houston. And I just saw dollar signs in my head. I'm like, no, I'm going to take you to the naturopath and we're going to figure out what's causing this problem. And so one of the things that she found was a pancreatic fluke.
Not super common.
Like, that's not very common, but she also told me that it's very common for pancreatic cancer to be caused by flukes, parasites, which that's interesting.
Yeah, so that's what you would call like a stealth pathogen.
Yeah.
And what's really interesting, this is all a part of like figuring out what's the root cause of why does my cat not feel good, or your dog, your pet. And there can be these pathogens that are hidden in the body, or viruses. We hear about it with like Lyme disease is a big one, Bartonella in the human side.
Yeah.
And what's happening is it's kind of sitting there like triggering this low-grade inflammation. It's also causing the immune system to overreact and be in overdrive. And so I think what happens essentially with that is all of a sudden now you've got your body looking at this foreign thing, and now it's attacking itself, and you go into an autoimmune like state, and it starts breaking down. And with the pancreas, I mean, if you get any inflammation, this is what can happen with the pathophysiology of pancreatitis. It is full of digestive enzymes. You do not want those digestive enzymes outside of the pancreatic cells, and not, you know, they essentially, what happens is they go into the GI tract, they're helping to digest the food. That's what they are meant to do. But if there's inflammation and you get leakage of those enzymes, it will break down the pancreas, and you can get scar tissue. And this is why with repeated bouts of pancreatitis, each time that happens, it increases the risk of your cat developing diabetes, because now they can't produce the insulin. It's not going to function the way it's supposed to. So, and that's also why it's really painful. Like, you know, thinking about your pancreas is essentially digesting itself. That is very sore, very painful disease, which is why, you know, pain medications are definitely part of the treatment option to help get your pet back to feeling better.
Yeah. And to answer Christine's question here, we used an herbal remedy by Hannah Kroger for that. And I cannot remember the name of it, but I remember it was a Hannah Kroger herb. And then I eventually did change the diet. He never had another bout of pancreatitis again. It was incredible.
Yeah, it's crazy.
But it, you know, I really do think, looking back, that diet was a big part of that. And the parasite was just a
secondary thing.
Yeah,
100%. It's, you know, your diet, when you think about, and this goes back to what I was talking about with the microbiome, there's a lot of amazing research coming out showcasing how we know 80% of the immune system is in the gut. And if we are feeding poor quality food and we aren't supporting a strong immune system, we're not going to have a strong gut health. And what's going to happen is it sets up the ability for other things to go wrong in the body. And so, you know, I think feeding like these higher quality, or feeding the higher carb diets like kibble, you know, what's happening is the body's just getting weaker. And it's setting up the stage for all these weird conditions that don't seem related, right? How many cat parents here are going through that, where it's like cat's doing this one day, then they're doing that. And you're like, what is happening? And your vet's like, I have no idea. And they start treating symptoms, and we're missing the root cause, that the diet is not helping and supporting optimal health in your cat's body.
Yeah. So talk about some of the symptoms, because they can be kind of vast and complicated.
Yeah. So definitely, I mean, one of the most common ones is just inappetence, not wanting to eat.
Right.
And so we talked about that cyclical nature where the appetite goes up and down, and you know, your cat just doesn't feel good. They don't want to eat. They can seem like they're picky. Some of the other more common symptoms too of pancreatitis are going to be vomiting, diarrhea. So, you know, your loose stool. You may also see constipation because they're not able to digest their food properly. So just because it's not diarrhea, it could still be pancreatitis, or even if their stool is completely normal, it's important for them to check. You know, other signs could be if you've picked up your cat before, you pick them up from the abdomen and they're fine. And then all of a sudden you go to pick them up and they're starting to like growl, or they scratch you, or you have a behavior change. It could be because that front part, that we call that the cranial abdomen, is sore. That pancreas sits right by the stomach, right by the front part of the small intestine, and next to the liver area. And if that's inflamed, that can be really sensitive, and your cat may have these behavior changes.
Yeah.
What I've also seen too is they lay different. So cats that are like, used to like stretching out or curling up, if you're noticing that they're shifting a lot or they're changing the way that they lay, that can also be a vague symptom of pancreatitis. And even those symptoms where your cat, maybe they're social, they love hanging out with you at night on the couch, and now all of a sudden they're hanging out in the other room by themselves. Now, here's the thing. You're probably thinking, well, those sound all very vague. They can be related. Those can be symptoms of pretty much like any condition, right? That's why it makes it so hard sometimes to diagnose this condition, this common condition for cats, when you go to the vet. And that's also why it's really important, if you're seeing behavior changes, you're seeing appetite changes, you're seeing GI changes, you need to go in, and also you can ask for some of these tests that your vet can run with, the routine blood work that they run a lot of times when they're ruling out certain diseases.
Right. Right. So let's talk about some of those tests that you would recommend if there's a suspicion that maybe this is a pancreatitis issue.
Yeah. So I always recommend, for one, you need a baseline. So baseline blood work. So that's like your CBC, looking at white blood cell count, seeing if there's some type of infection or inflammation, red blood cells. So making sure they're not anemic. And then your biochemistry profile. So checking kidneys, liver, protein levels. Those are all going to be very important. But here's the thing. We can also do what are called spec FPLs. And so this is more specific for your pancreatic enzymes. And there's a CPL for canines and an FPL for cats. And some clinics will have little snap tests. So if you've ever had like a heartworm test done in the clinic on a routine wellness, a lot of times they're little snap tests that they can run in 10 minutes. So some clinics will have the ability to do that. Otherwise, they just send the blood work out and the normal lab can run that. That's going to be more sensitive than just looking at things like amylase and lipase on the routine blood work. A lot of times those are going to be elevated, but we've just found that our spec FPLs are going to be more sensitive to actually truly diagnosing how inflamed that pancreas is. So that's a really good test to ask for. If your vet, just make sure they're running that if you're concerned and your cat's showing any of those symptoms. That is always kind of like the baseline. Like that's just the beginning. Those are going to be your cheaper tests, right? If those come back kind of, I'm not sure, like the liver values might be a little bit elevated. Remember that pancreas sits right there. So if it's inflamed, it can also secondarily inflame the liver, which can make those liver values sometimes go a little high too. And so if we're finding that there's kind of vague signs on the blood work, the next step is usually an abdominal ultrasound. And the reason why we go to abdominal ultrasound versus, say, like an X-ray is not a bad thing to do, just to make sure there's no blockage or masses or things like that. But the ultrasound is really great, because when we look at when we use the probe to look at the tissue, we can actually see if the tissue's inflamed. So the pancreas, if it's inflamed, will glow. It'll look whiter on an ultrasound. Now, obviously, if it's really glowing, not good. It's really inflamed. So it can be harder to see, but it is one of the most sensitive ways to actually assess what's going on. You can also look at the liver. You get an idea what's going on with like the gallbladder. You can assess the entire intestines. You can see if the intestines are inflamed, like the lining. So your ultrasounds, yes, they're more expensive, but they can be really good for getting an answer and seeing what the rest of the abdomen is doing to make your cat not want to eat or to not feel good. So I highly recommend, if you're able to do that diagnostic and you're just like on this vicious cycle, or you just want to know right away, highly recommend it. We did that with Tico this past week. Vomiting, diarrhea, new rescue cat, have no previous medical history. And I was like, we're doing all the tests. And I told his vet, because we had to go into the conventional vet for all this, because I do house calls. And I said, do all those tests, and then it all came back kind of like, oh, we don't know. And his pancreatitis test his spec FPL was negative, and I said, we've got to do an ultrasound. And the ultrasound gave us the reason why. He was not eating, he was having vomiting and diarrhea, he had pain in the front part of his abdomen, and it told us he has cancer, which we can now treat appropriately rather than waiting and watching him and wondering. And so that's the power of doing those tests, will help you treat it much faster. Whether that's conventional, whether it's integrating, whether it's just holistic remedies, it'll get your cat back on the faster path of healing and feeling good again.
So I have a question. You mentioned, because the liver sits right next to the pancreas, if the digestive enzymes are coming outside of the pancreas, can they affect the liver?
100%.
Cause liver disease or like necrosis of the liver because they start to digest parts of the liver? Or
yeah, I wouldn't call it necrosis. I would call it more like an inflammatory, because the liver is really good at regenerating too.
Yeah.
So if we have acute inflammation and we catch it, what we can always do is we can repair it. And this is why I use a lot of like antioxidants, and also liver support. So a lot of cat parents here have probably heard of milk thistle. So using your milk thistle to really help support that liver health. We're also supporting the detox pathways in case there has been like chemicals that are causing that inflammation, coming from the food or, toxins or other medications. So using things that are going to support the liver are really good. I also use natural anti-inflammatories. So that's where your omega-3 essential fatty acids. So things like using you have to be careful with fish oils though, because high fats can actually stimulate the pancreas and make pancreatitis worse. So I tend to use those once we're out of like the acute phase. So when I say acute, it's like, oh, it's grumbly, not feeling good. And then we help support them past that. And then they're over it, they're back eating again and feeling better. That's when I integrate in your omega-3 fatty acids. So in fish form or your oil form, starting small and working your way up, because they're really great at helping to remove inflammation and support the cell health. And so using those. Also, I like using things like turmeric or curcumin. Those are really great natural anti-inflammatories. And even just maybe grating a little bit of turmeric if your cat will eat it, or using supplements. There's a lot of great quality supplements out there made for pets that you could just dose based on your cat's body weight.
Exactly. Do you have any other recommendations as far as other products? Well, let's talk about this. I have heard and have always recommended to my pet parents that have a cat that kind of struggles with pancreas issues is to always use digestive enzymes.
Yep.
To get support, to kind of let the pancreas take a break, doesn't have to work as hard. And then those extra enzymes can help do the job necessary.
Yeah, I highly recommend that. And it's interesting. I don't know where I've heard from like clients saying their vet said, don't use it, it makes it worse. And I don't get it, because I've seen studies that show, and also from what we know how digestive enzymes work, it takes the pressure off of the pancreas so it doesn't have to work so hard. Because what those digestive enzymes are doing they're helping to break down the proteins, they're breaking down the fats with the lipases. So we can use that to help digest food better so the body doesn't have to work so hard. And 100% those, and cats on kibble should be on a digestive enzyme anyways. 100%. Any animal that's on a kibble diet, I recommend just starting the digestive enzyme, because it is very tough for their body to break down. It's changing the pH of the stomach, and they're just not processing it well. And I see it leading to leaky gut, which, that inflammatory state, and then it sets up everything else, all those other inflammatory conditions. And so if we can support and help their digestion with digestive enzymes, the other thing I tend to add in too, because we know that there's a microbiome issue, usually there's that leaky gut condition, is I use probiotics. I use a good broad spectrum, meaning multiple strains of probiotics to help them. And if your cat's been on antibiotics or another chronic medication, using beneficial yeast like Saccharomyces or using spore-based probiotics like bacillus strains can be really beneficial to help them, and they're stronger. So they're not just killed by the antibiotic if your cat is currently on an antibiotic. So it can help reestablish that good microbiome once again, once they hopefully get off of those antibiotics.
Right. Have you used like a B12 or a B complex with that as well?
100%.
Yeah.
And, you know, anytime we have, especially like GI issues, you know, IBD, especially inflammatory bowel disease, where your cat's not absorbing nutrients well, we have some degree of malabsorption. Your B12s also can help as an appetite stimulant too. So for these kitties that aren't feeling good, that is something that we can add in. Another really good one that, you know, if your cat's on medications, make sure you talk to your veterinarian, but I use a lot of CBD with my cats. And I find that we have this entire amazing system called the endocannabinoid system, and it's there to help maintain homeostasis or balance. But what is going on is there's a lot of receptors that are actually in that gut lining. And so we can actually use the CBD is what we call phytocannabinoid. So we're replacing, if the body's not able to produce enough of its own natural endocannabinoids to work on these receptors, reduce inflammation and help calm them and have the appetite stimulant properties, we can use the plant component and rebalance the body. And cats, they don't need a lot when we're using it for that. And so we can use a lot of times if we want to use good quality sources. So making sure they have certificate of analysis and do your homework, make sure it's organic and all those things. But that's going to help rebalance the body, and it helps gut health. And it also helps with a lot of the anxiety that can come. It stimulates appetite, and it can be used alongside all these other supplements that we're talking about. So you could always start with other things first. And if you're not getting anywhere, that's where being able to add in these additional nutraceuticals can play a huge part for helping your cat heal naturally.
Right. And I find a lot of times people just aren't using the right potency of CBD.
Yeah, it's too low.
And they're like, oh, it didn't work. Well, did you use enough, and did you use the right potency?
Yep.
And so typically I would think, what, a 500 or up?
Yeah. And also, so what I typically use for an anti-inflammatory dosage, I'm thinking like 0.5 mgs per kilo. So most cats, if you're saying like, we're using roughly 2.5 to 5 milligrams per cat for a 10-pound cat. And so when you look at the concentrations, a lot of times they're like 100 milligrams in an entire bottle, and you give one drop and it's like nothing. And so this is where people are wasting a lot of money, unfortunately. They're not using good quality. Anyone and everyone can make these products. Keep that in mind.
Yeah.
And so you need organic, because they suck up all the chemicals, heavy metals, glyphosate from the ground. That's how the cannabis plant, like, it sucks everything up. Yeah, it's a sponge. And so also make sure you know, like, so where are they sourcing? Are they testing the product? So certificate of analysis, or COA, looking at what are the chemicals, is it broad spectrum? That's a full spectrum product, or is it an isolate? And I find that full spectrum products are going to contain more of those terpenes and going to have the beneficial synergistic properties of that plant that we love and use in like herbal medicine, so Western and Chinese herbs, and are going to have better benefits in your cat's body. So look for full spectrum on the label. That should be on there. And make sure there's a COA, make sure it's organic, and make sure it's a higher concentration. And then based on how your pet does, I find usually dosing twice a day is going to get those levels more stable in the body too. But each pet is different. So not every cat does well with it. It does kind of smell. Those are the terpenes in the plant, but it's non-psychoactive. It's not going to make your cat high, like THC, the other component of the cannabis plant. And it can be really, really powerful at helping them, and, you know, as a natural anti-inflammatory. So this is a painful condition.
Yeah.
And so using that can really help minimize that pain, support their appetite, and also reduce hopefully the need for conventional pain medication that can also, you know, upset the gut, or, you know, cause kidney or liver problems and things like that.
Exactly. Are there other therapies that you find that are very effective in helping recovery for pancreatitis? I'm sure
Yeah,
you do because you use a lot of different things.
I do. So I use a lot of Chinese herbal medicines to
Hmm.
help rebalance. So that's
Hmm.
looking at where is this pet's root imbalance and how do we help with that. So typically looking at Chinese medicine, it's going to be like a spleen qi deficiency. There's going to be some like damp heat. We might have some liver involvement. So the herbal formulas that we choose will be based on what that pet is showing us as a root imbalance. The other thing I tend to use with these kitties is acupuncture.
Hmm.
And acupuncture is a great resource if you have access to it. And it's going to help modulate the immune system. It also gets the chi and blood flowing. It helps with stagnation. So
Yeah.
it's helping that chi and energy flow through those meridians again and support digestion and support immune system. And there's different points on the body that we can manipulate by either doing acupressure or using acupuncture needles to help
Mhm.
these kitties. One of the points that I love it on the body because it can be used for so many things, is stomach 36. And it's right just down, just a little distal to the, so just further down from the knee. So typically like a centimeter down and 1 centimeter over on the outside of the like calf area.
Okay.
And just look up stomach 36 and you'll be able to find like a picture, and even just gentle massage and stimulation of that area. It's direct connection to the gut health. And it's
Mhm.
also direct connection to the immune system. So it's a very powerful point to help tonify and support the overall systems of the body. So if you can't access an acupuncturist, you can do acupressure at home with your cat. So I love those two modalities. I don't use a lot of homeopathy, but it can also work really, really well. And I know, Pam, you use that for a lot of your patients with great success.
I
So,
do. I do. Arsenicum album 30C is great to use when they're having a flare up. And then Iris versicolor is another remedy that's pretty common for pancreatitis as well. So
awesome.
when my cat Hershey had the flare ups, it's interesting. There's a brand called Energetics that is like a combo homeopathy brand, and they have supplements for humans, but you can use them for pets. But there's a product called Pancreaforce, and it has the B complex, it has the digestive enzymes, and I think it has turmeric in it because it's
Mm.
orange.
Yep.
But then I'm
Contains
thinking
everything, FYI. If
it
it gets
has
anywhere.
everything in it that's so good. And so I would basically open up a capsule and give him a quarter capsule mixed into some baby food, and he would eat that because he wasn't eating anything else. And I find that baby food is a good bridge food,
I
because
love
they're not ready for their canned food. They're definitely not ready for their raw food because their stomach
Oh
is just
no.
food is blah. So baby food is a great transition food. And then
Yeah.
I would also, if you just have to get them some kind of nourishment, I would syringe goat's milk,
Mm.
just something, to get some calories in him, to get him through that little hump.
Yeah, I find too that you're like a lightly cooked egg can
Mm,
also be really helpful too. A lot of cats will like that.
Nicole.
I've also do like lightly cooked like chicken, bland chicken, and
Mhm.
nice and warm. So with that warming energy, it's a really
Mhm.
chicken is a really good chi tonic supporting that energy too. So those are great options. But yeah, I love using meat baby foods. They're just gentle. A lot of cats they love them, especially when they're not feeling good. They're a little bit stinkier too, so that helps with the
Yeah.
smell. Because if it's too bland, they just don't want to eat it.
Yeah.
And that's also where like warming up the foods can be really helpful. And I love also using broths.
Mhm.
So if you can make your own broth, especially with us being in the winter time in the US, getting that crock pot out and getting some broths going and storing it in your fridge and freezer to have on hand. That can be helpful too. If you ever need to syringe medications, using a bit of broth can provide some really good nutrients to support that gut lining and help give them a little bit of extra energy too.
Yeah. Yeah, so we have a few minutes left before we're going to wrap this up. So, do you have any success stories that you can share of clients that kind of turned around from serious bouts of pancreatitis, or any case studies that you can recall?
Yeah, so I actually had one of my clients, she had been kind of down the path that a lot of cat parents are down, where the vet was, you know, she was doing some diagnostics and they were saying like, this is just how your cat is. He's just picky. And we were able to, so she ended up getting a diagnosis, told her to check that specs FPL, and rule out more sinister things, of course, like cancer. And the cat was actually vomiting blood. And yeah, it was really bad. And so he was on a lot of antibiotics and he was on like Pepsid and, all the things to like that were just affecting his digestion.
Yeah.
And, prescription diet, of course, your ID. So he was on all the things that weren't really supporting the healing of his body. And what we did is that we actually put him onto a lightly cooked food. So we used some of those foods that we just actually talked about. And then I used some of my Chinese herbal therapies with him. So we used a formula for him. I believe he was on San Ren Tong, a 3 seeds combination formula. He had a bit of like what we call dampness, damp heat in his body. And it's a common cat formula, Chinese herbal medicine formula. Keep in mind when I talk about Chinese herbs, we're using it specifically for the individual pets, and each pet will have a different constitution and pattern. So it may work well for your cat. It may not fit the pattern, but for him, it worked really well. And within it's probably about, I typically give it, depending on the case, like he started eating again, and we use probiotics and digestive enzymes. And then we started the herbal medicine. And within probably about 5 days, he was back to, he also had diarrhea. So his entire GI tract was inflamed and angry and upset. He was back to having normal stools. He was back to like jumping up on the high places where he was like, he loved being at. He was following mom around again, and meowing, which he had stopped, and he felt great. And what we ended up doing is we used the herbs for a period of time, and then we maintained him on. So we ended up changing him to a raw food diet once he got through his flare up, and it was probably about 4 to 6 weeks after. And then he stayed on the probiotics and the digestive enzyme support. And then I also use a lot of like whole food supplements. So things like from Standard Process. So we used your feline whole body support and the glandular support to help him, and the enteric support on the cat side. And he did great. And he didn't have another bout of pancreatitis. And I think that's really powerful. The other thing is what I find with these cats, the emotional or energetic side of the stress can play a part and affect the pancreas too. And so I've started using more actually like herb gardens. So with like Julianne Thorne from Naturally Cats. And I find that putting down with cats, medicating them can be really hard. So creating that herb garden and putting down dried herbs. So using herbs like angelica root, using herbs like comfrey, using peppermint, using your Roman chamomile to really help calm, support, even fennel if you have a really gassy cat, or just, their gut health is upset. And you can allow your cats to self-select what they want to chew and munch on. And I've had a lot of success with a lot of clients that have these low grade, not necessarily diagnosed pancreatitis issues, but they're going through that phase where the client's like, I don't know what's wrong. I'm like, just put down the herb gardens if you don't want to do these diagnostics, or you can't afford the diagnostics. These organic dried herbs are pretty cost effective, and you only need a tablespoon and your cat will self-select the remedy it needs and wants.
That's amazing.
Yeah, the herb garden, honestly, and it's been a huge help for our own house with the 3 cats and integrating in a new rescue and him being sick, and then the other cats being a little stressed. It's been amazing watching like my one kitty munch on like valerian, like literally chowing into it, like valerian beard. And I'm like, it's like, oh my God.
Give me some valerian.
I need valerian. You're stressing me out, man. But it's really cool because I didn't have to medicate him. My 2 other cats are just, they are not fun to medicate, and I don't want to stress them out even more. So it's a great, easy way to like put down a towel in a quiet room and put down different herbs that help support digestion or calming properties and just watch them. And I love it. Moki was like rolling in it the other day. I have to post a video on social media. Like he was just covered, literally covered. He was eating rosebuds. Rosebuds are really good for calming. And I was just like, this is fantastic.
Oh my gosh, that is so funny. Well, Dr. Katie, tell our listeners and viewers where they can find you in case they want to do any kind of a remote consultation for telehealth or just access your amazing resources on your website, your membership, all that good stuff.
Yeah, so you can find me at thenaturalpetdoctor.com. We're also on Facebook and Instagram at The Natural Pet Doctor. We do weekly coffee talks with the doc every Friday on different pet health topics and Q&As. And then we also have a YouTube channel. So Dr. Katie Woodley, The Natural Pet Doctor.
Awesome. Well, thank you guys. This has been so fun, and I hope it's been really, really informative. It is a topic that is near and dear to our hearts, and we see it so common. So we thought it justified having a discussion about it. So anyway, thank you so much for sharing your time. I totally appreciate you. Have a blessed Christmas and a wonderful New Year's. Happy holidays to everyone. Check us out on social media. Come sign up on our websites, our blogs, all that good stuff, and follow us. We would be honored to have you as part of our platforms. And so appreciate you guys attending tonight. So until next month, thank you and have a great evening.
Thanks, everyone. Take care.
Bye.
You are listening to the News to the Soul